Good morning, everybody. Okay. I hope everybody is well in this time of crisis, where everybody's a little upset. I will be giving a lecture, a taping. I'm taping an hour and 15-minute lecture on the coronavirus. It'll be available to everybody. I don't know when it's going to be, but I'm giving a lecture on microbiology this Friday. So when it's up and available to everybody, you'll have access to it. All the new drugs, experimental drugs, drugs currently used, vaccines being tried, everything. So I'll up-to-date you on everything, so you'll be experts on the coronavirus. As far as anatomy, your class, we did the quiz testing. I'll discuss with the dean how we're going to move forward with your test. This is a stressful time. So one of my jobs is to assuage or lessen your stress, which enables you to learn, because that's my goal and that's your goal. So I will keep you abreast of that. As far as testing, I should know better by the end of the week, and I'll email everybody, and then we'll discuss it next week's lecture. Any other material, I'm in the process of taping. So there will be material that will be available to you. Yeah, you have to go through a site where you'll see lectures that we had to make up and stuff. So I will also keep you appraised of that. So we're going to do everything we can to lessen the level of stress and heighten your degree of off-campus learning, which is what we're doing now. So I'm going to begin. The camera, I'm off site myself. Even though I'm off campus, I'm doing it at a business site. So I'm still learning all the different the camera angles and the focus. So every time I move, the camera will refocus. So it's not that you're going blurry, it's that the camera is going to refocus on me. So don't get concerned. I'll try to keep my writing, the letters as large as I possibly can for the size of the board. All that stuff we can work through. So I'm going to begin with the electrolytes, okay, and then we're going to do acid-base, which is very, very important because you have to understand the acid-base disorders, which is a big thing in not only nursing, but in the medical field in general. So we started that when I talked about the pH of the blood early on, but now we're going to delve into it in a little more complicated matter. All right, so we're going to begin. So let's do what an electrolyte is. I'll give you some of the functions. You've all probably heard on the news, on the bottles in the stores, electrolytes this, electrolytes that, but electrolytes are essential to human or to normal physiology. We did the water balance. When I said you're in fluid balance, if you recall, I'm just quick reiterating, we haven't seen each other. When you're in fluid balance, it's the right amount of fluids in the body. It's the right amount of fluids in the different compartments. So to quickly reiterate, an accumulation of fluid in the interstitial compartment is called edema, or the interstitial space. An accumulation of fluid in a body cavity is called an effusion, right? So these are strict definitions. So for exams, we have to adhere to the strict definitions. So you have to remember those fluids move back and forth between the different compartments. Then we had the intravascular compartment. Then we had the lymphatic vessels. Then we said when you're in fluid balance, it's also the composition of the blood, the state of the body fluids, such as temperature, and I separated out when we did composition of the fluids, if that means, for example, the amount of glucose. So when you do a blood test, the doctor orders a blood test, and he orders or she orders a serum glucose. This is what they're ordering. They're ordering and they're checking for the right amount of glucose in the blood. Okay, so when you're in balance, your glucose level should be between 65 to 115, or different books will have slightly different values, 70 to 120. We already discussed that. I separated out the last composition, so instead of adding it with under the group of composition of substances, I separated it out as a separate group when you're in fluid balance. That is the electrolytes. Okay, so electrolytes, if you recall, when you place something Are you talking to me?
No, I was just saying for everybody to mute their mics unless they have a question.
Okay.
There's a lot of background noise.
Okay, so when you place a substance in water, and most of the time, you remember the body fluids, the general component is water. Does very often, depending where it is in the body, doesn't look like water. Why? Because there's many things dissolved in it, many things suspended in it, so it's going to change the appearance of water. It's going to change some of the characteristics of the water because there's things in it, but it's nonetheless still water. So when I use the term body fluids, we're referring to water. Plasma is 92% water, blood plasma, which we did. So when you place a substance in water, it will either dissociate, or that means ionize, and remember, as a quick review, we talked about ions. What are ions? I'll put up here. They're very important in physiology. Well, we're talking about humans. I'm not worrying about cats, dogs, birds, but ions charge. Charged substances are essential for life. Ions are charged substances. So they have either a positive or a negative. So as soon as you see a positive or a negative charge, you know you're dealing with an ion. Okay, this is going to be very important when we get to the acids and the bases, this basic premise, when something ionizes. So when something ionizes, it forms ions. Okay, so when you put something in the water, one or two things once again will happen to it. It will either ionize, that means form charged substances, or it will non-dissociate, non-ionize. So I'll draw it on the board. I might have done this already, but I'll do it again. It's worth repeating. But right now you have, this is what a charged substance, so let's quickly review. Chemical abbreviation for sodium, natrum, is Na. That is not an ion, right? That's neutral. Remember we talked about the number of protons, number of electrons. So once this goes to this, of course that means it's lost an electron. Right, an electron has come, or I'll make a little e or a little electron, one electron, and so there is our charge. I'm still using black ink because I'm waiting on the red colors that I'm so used to using at the school and you're used to seeing also. I believe in color-enhanced learning. either actually as a reading process or putting it on the board, the red is not coming out as well as I anticipated, nor the green. So we're going to be stuck with the black until further notice. So here is our sodium. There's the positive charge. So this is now called an ion. Okay, this is now called an ion. All right, then I'll give you what type of ion momentarily. Let me erase that so we can get rid of that. Just for a few more examples, because you're going to be hearing about sodium and calcium and potassium for the rest of your nursing careers. Calcium, that's the abbreviation for calcium. That is neutral. The number of protons, positive charges, number of electrons, negative charges are the same. So there's no positive or negative excess. When it goes to this, okay, calcium has lost 2 electrons. And there's your positive charges is 2 because it lost 2 electrons, so now it has 2 excess positive charges. So many of you have had this before. We've already covered it. For those of you who are still feeling a little unsteady on this ground, it's well worth the review, quick review. So when a substance loses electrons, it's once again called oxidation. So this whole process, when it goes from neutral here, nothing, to positive, it's called oxidation. So we're going to see, these ions are going to be called cations. I'm going to list it so you don't have to worry about copying it right now. Let's erase this. I'll just give you the one example there. That's chlorine. That's the abbreviation for chlorine. When chlorine, this is not an ion, doesn't have a charge, doesn't have a negative or a positive charge, but it goes to this. It now has a negative charge, so that is at very basic levels an ion. Okay, so what has happened here? This is gain. Of an electron. This is very important in medicine because chlorine is a lethal gas. We don't have chlorine in our body. Okay, so it's the importance of charge. You can start to appreciate the importance of charge. The simple loss or gain of electrons or protons, which are hydrogens, can mean the difference between life and death. All right, so charge is very, very important. So this, when you gain the electron, this is once again an ion. It is called reduction. So this process is called reduction. Reduction is the gain of electrons. Oxidation reduction, once again, these go on all the time in our body. If you didn't have these processes going on, we wouldn't be here. Oxidation, reduction reaction. So when something is oxidized, loss of electrons. Once again, loss of electrons will produce a positive charge. Reduction, this is once again, before we jump into some of the harder stuff, is gain of electrons. And of course, that will produce a negative charge. So let's okay, so many substances can be placed in water and ionize and form either a positive or negative form ions, positive and negative ions. Some substances do not dissociate. They do not develop a charge. So I am going to erase this here. And I use this because it helps me also augment your memories. That's sodium chloride. That's our substance. Sodium chloride. When you put that in water, it dissociates or ionizes. So that is called ionization. Happens all the time, or dissociation. You could. We're going to focus on electrolytes. I'm not doing organic acids that ionize, but I'll give you an example of one. For example, when I put glucose, what's the brain's primary fuel source? Everybody got it right on the test. Glucose, right? So if I put glucose, and once again, this is sodium chloride. This is glucose, C6H12O6, which I gave you that formula several times. When you put that in water, it doesn't ionize. It just says glucose. All right, it dissolves, right, because the molecules are so, remember we did the I'm not going to review all that. We did the concept of mixtures, remember the crystalloid, the solutions, which are all crystalloid we talked about, the colloid solutions, the suspensions. Well, glucose is so small, the glucose molecules, that it can dissolve. You can't see it. You can see right through the solution. But glucose does not ionize. It says glucose, okay, whereas certain substances will ionize. Okay, so I'll give you the example.
Dr. Farrington?
Yes.
Hey, I don't know if everybody can, but I can't see the far left, what you did on the far left. I see the glucose, but what about the NaCl?
Can you, you can't see that?
No.
Jacob,
You could touch the screen and move it.
yeah, just double tap the screen and it will,
All right, because, can you see it now?
Okay, I got it.
You got it? Has everybody got everything, the whole board? Well, you'll tell me, because this is, we got to fine tune it. It takes a little time, so, but everybody can see the two beakers I drew?
Yeah.
Okay, okay, great. All right, so here's our example of when you place something in water, it'll either ionize and form ions. There's our sodium plus, a chloride negative. Glucose does not. So ions they can be atoms, right? We just did those, for example. Those are 4 atoms. They all have been, the sodium, the potassium, and the calcium have been oxidized, so they've lost electrons. Those are ions. The chlorine, it's now chloride, the Cl negative, has gained an electron, so it's been reduced. All right, so ions can be atoms. Okay, they can be molecules. So remember, a molecule is 2 or more substances. This is a very big one that I expect you'll remember. HCO3 negative. So we know right away it's an ion because it's negative. Whenever you see a positive or a negative at the end on the top, you know it's an ion, positive or negative. This is called the bicarbonate ion. You're going to hear a lot about it later on today. This is called the bicarbonate ion. Don't forget that. It's very important. So you can see it's a molecule. It consists of a hydrogen, a carbon, and 3 oxygens. Ions can also, another example, they can be inorganic, or organic substances. So let's see, we gotta. So an organic substance always contains carbon. Okay, so let's put it up here. I'm going to erase the ion. So okay, that is an organic acid. That is called, you're going to hear loads about it. That's why I drew it for you. So, and I'm going to use this as an example. This is called lactic acid. It's an organic acid, I know, because this here, this is an acidic group. So see, as soon as you see on a molecule COOH, it's an acid group. So it's a carboxyl group. It's an acid. So you can see right here, and I wish I did. Let me see if I could use the green. See, let me know how the green looks here. No, that's not too bad. I'll use it for little highlights. The ick means it's an acid. Okay. Now we're going to learn shortly after this that this can ionize. So when it ionizes, that means when it's in a fluid environment, it's going to develop what? A charge. So watch what happens when it ionizes, just so you understand the icks and the eights. I'm going to erase this bottom here. So now watch will happen. This has now ionized. We put it in water. So you see something happen. What happened to the acid part? It ionized. So here's our ion, right? We have, this has become negatively charged, and it's given off a hydrogen that has a what? A positive charge. So it's ionized. That's what they mean by ionization. You put this in a beaker of water, it's going to ionize. So that's what happens to it. This is no longer called lactic acid. It is going to be called lactate. All right, so what happens when a acid, organic acid, dissociates or ionizes? The ick becomes an 8, the ending. So the ick, here it is, the ick ending. Lactic acid, it could be pyruvic acid, there's all different acids. Once it loses, and we're going to do this with the ketone bodies again, so you know you're going to get the ketone bodies. When the acid is like acetoacetic acid, beta-hydroxy acidic acid, these are all a beta-hydroxy acid. When the acid loses a hydrogen and it becomes ionized, it goes from the ick name to the 8 name. Okay, so this is, you have a loss of it got rid of its proton or an electron, so it becomes negative charged. I don't want to confuse you with the electrons yet. So it will acquire a negative charge. So the 8, when you see the 8, it has a negative charge. So anything that ends in ATE, pyruvate, lactate, they have a negative charge. So they are ions. Now we're not going to be dealing with too much of those because that's getting into organic chemistry and biochemistry, but I will keep on this. I'll give you one more example because you're going to hear about this one also. So I'll leave the lactate up here. Okay, so once again, this is now lactate, not lactic acid, because this has given up its hydrogen, right? Here's the hydrogen. So what happened when you put it in water? It ionized. It formed ions. This is a negatively charged ion, and this is a positively charged ion. So here's one more example. This is called pyruvic acid. There's our ick. There's our ick, pyruvic acid. This is an organic acid. You're going to hear about pyruvic acid because when you break down glucose, this is one of the chemicals that are produced. Pyruvic acid, when it loses an electron, becomes a proton rather, right? It's ionized. Put it, say, for example, water. It's ionized, and now it has a negative charge. And there's our positive charge. So that's our definition of ionization, all right? The formation of substances with charges. So this ionized. This is no longer called pyruvic acid. This is called pyruvate. So once again, the ick ending or suffix changed to the suffix pyruvate. So once again, when you hear, when you're looking at terms, it's easy for an exam because sometimes you don't even know what the hell chemical they're talking about. But if you recognize that it's an ick or an ate, if it's an ick, it's in its acid uncharged form. If it's an ate, that means it's been ionized, it's a negative charge. So anything with an ate ending has a negative charge. And we're going to then now classify them. So these are important reactions. We're going to go back to them. We're going to, once again, I'm keeping chemistry kind of simple, but just enough to help you with pharmacology. All right, so I can erase this. On exams, I'm not putting diagrams, so you don't have to worry about any of this. This is not a chemistry course. This is to get you up to speed. With certain concepts, because I want you guys and gals to be the best and understand it. And so you need a very basic but strong foundation in chemistry. All right, so ions. Can be classified, remember, ions are positive and negative charge. So even anything, when you hear ionization, that means the formation of ions. All an ion is, you can visualize something that either has a positive or a negative. Okay. You have cations. There's ion right in the word. These are positively charged ions. These are some important ions that you'll be hearing about. Probably everybody should be taking a little zinc now because zinc is very good for the immune system. So I cranked up my zinc. Not trying to sell you zinc, but zinc's very cheap. It's also good for wound healing. Zinc has many, many roles in the body. So if you feel like you're getting ill, you should always take zinc 2 or 3 times a week. A zinc supplement is very, very good. Also vitamin D. But these are all what? Ions, sodium, K with a plus is potassium, Mg is magnesium. That is 2 pluses. So Mg is magnesium. Here, I'll put it here. Magnesium. That's a positively charged ion, so more specifically, it's called a cation. Now, the doctor's not going to say to you, when you're an RN on the floor, or the nurse practitioner, or the physician's assistant, they're not going to say, I want to do ion levels. I mean, they're going to order, these are also known as electrolytes, which we're going to do momentarily. Ca with 2 charges is calcium. And Zn, once again, is zinc with 2 positive charges. These are all cations. These are also known as electrolytes. Now I'm going to just give you the negative ones, then we're going to do what an electrolyte really is. But when the doctor orders electrolytes, this is what he or she, or as I said before, or the healthcare provider, this is what they're looking for. Okay. The other end of the ion is, of course, anions. I'll put anions out here. anions have a negative charge. Oh, let me just, before I forget, let me put here H plus. Because H plus, here's my green, I like it. H plus is a ion. H plus is a cation because it's positive. H plus can also be called a proton. So if you remember this, it is going to help you immensely when I do acids and bases and when we do metabolic acidosis and alkalosis. Today I'm spending a lot of time on the acid base because you have to understand it. Okay. In future, when you're having problems with it, seek me out at the school. Whenever you get back to campus, I'll be glad to sit down with a group of people and do this on a lunch break because this stuff gets hard. But once it clicks, all right, some of you are going to like doing acid-based problems. I know. You know, a lot of people don't like math and chemistry, but this is very interesting stuff, and it's very germane, and it's mandatory. You got to understand it. All right, so this is, once again, H pluses are also called protons. It's the only ion that can be called a proton. So when you hear proton, you should be thinking in your head H plus, H plus, H plus. Proton, proton, proton. Anions, negative charge. There's two examples of chlorine, which has been reduced. It's gained an electron, and it's become an ion. More specifically, a negative ion. Therefore, it is an anion. Okay. This is iodide. So that stands for I is iodine. So when iodine, and the essential need for iodine is the body is to make the thyroid hormones. So iodine is a very, very important element. As a matter of fact, iodine deficiency worldwide has caused millions of babies to be born with something called creatism, which we'll do at a time, and a component of that is mental retardation, growth retardation, all sorts of problems because the baby does not have adequate amounts of thyroid hormone. So thyroid hormone deficiency worldwide is responsible for at least 20 to 30 million people have irreversible brain damage because they were born with low thyroid hormone levels. So all babies have to be assessed for thyroid hormone deficiency because if it's caught, all you have to do is give the baby thyroid hormones. So iodine is very, very important. It has to go through a process, it's called oxidation, when you lose the electron, and now what does it become? So I'll put oxidation once again for your notes. The more I put it in several different ways, the better the chance that you're going to remember it. Oxidation, loss of an electron. I'm talking about the reduction. This is gain. Change that immediately. It's gain of an electron. So correct that in your notes. I don't want anybody walking out or leaving the screen on a break without the correction. So when you go from iodine, which is neutral, to iodide, which has a negative charge, that's once again, change it. It's called reduction. You have a gain of electron. You now have, once again, a ion. It is a anion. That means it has a negative charge. I'll put one more here. And once again, you have to really get that. You got to remember the name of that. That's called the bicarbonate ion. The bicarbonate ion. Very important to remember that. This is going to be coming up time and time again with acid-base problems, okay, or imbalances. When you talk about metabolic alkalosis, metabolic acidosis, you're going to be looking at this. So I want you to understand that and memorize that name and that particular ion, or more specifically, anion. All right, so the last example I'll give you, just so you can see this, we're going to do electrolytes to functions, then I'll let you take a break. Looking at a screen, I know, is terrible. I can't stand it. So my computer time, pardon me, when I'm doing research or looking at is about 20 minutes at best. Then I can't wait to get off the computer. I start to get a headache and everything else. So I know, I'm aware of, for many people, looking at a screen for a protracted length of time can cause headaches and irritability, and so we're going to take a break soon. All right, but let's look at this one more time. It's well worth it to do it one more time. Here is lactic acid, the ick. That means it's an acid that has its proton. It ionized. It ionized, just like when sodium chloride goes to sodium, it ionizes, and plus with a plus, and chloride with a negative charge. This is ionized. So this has done the same thing. Now, once again here's our negative charge. There's our positive charge. You have a proton. Once again, hydrogen is the only atom or element that can, ion that can be called a proton. No other ion can be called a proton. So this is in, of course, the cation group, and this would be part of our anion group. So once again, when you went from lactic acid to lactate, lactic acid, put it in, say, water, it ionized, dissociated. It broke up into what? Ions. So now that became lactate. Okay, so this, it lost its hydrogen. There it is by itself. All right, so now this is now called lactate. So the ick became an 8. The ick ending became an 8 ending. Lactic acid became lactate. It ionized. So this is an organic ion. Okay, so we're going to stay away from them from now. So now you got a good review of that. Let's specifically do the electrolytes and what they mean. These are also electrolytes. So these are very important negatively charged electrolytes. So when a doctor or whoever the healthcare provider is that's ordering the test, when you order electrolytes, you're going to order some of these, or the negative, or both. It depends on what you're looking for in the patient. At the very least, you'll be measuring sodium, potassium, probably calcium, and chloride. Okay, if the doctor wants more, then he or she will tell you, and you'll check it off. As you get better, and some of you are going to be nurse practitioners, you're going to go on, then you'll be ordering all this stuff. So you'll be the one sitting at the station writing your orders. So what you're looking for in the patient will dictate what you're going to order on a blood test. Okay, so once again, ions, cations, positive charge, anions, negative charge. These are all here are called electrolytes. This is not an electrolyte. This is a ion. So now let's do the difference between an electrolyte and an ion, because an electrolyte has a slightly different meaning. So I'm going to erase this. Okay. Electrolytes number one now, this is more chemistry than it is nursing or medicine, because you'll understand in about 3 minutes what I mean exactly by that statement. But this is the more chemical interpretation of this versus what you're going to in the medical field. Okay, so it's a little bit slightly different, but I have to give it to you so you understand the difference. Okay, so we said an ion is any charged substance. Okay, it could be organic molecule like pyruvic acid, lactic acid, or it can be an atom, an inorganic, like sodium, which is inorganic, of course. The bicarbonate ion is inorganic, right? Even though it has carbon. Remember I said there were some exceptions. Organic chemistry, all organic compounds contain carbon. 99 point whatever % of inorganic compounds lack carbon. Okay, there are a couple of exceptions of inorganic compounds that contain carbon. Carbon dioxide is one, and the bicarbonate ion, HCO3 negative, is another. Okay, so we're not going into the reasons why. It's about 2 pages, 3 pages of explanation. So what is an electrolyte? These are substances Okay, I'm working on getting more dark markers. They actually should be here this afternoon, but they also, the reason they're called electrolytes, because they can conduct an electric current. Okay, so you're going to hear about electrolytes all the time. You hear about Gatorade, the compound, the fluid Pedialyte for children when they have diarrhea. So it's not just water that you're giving a child when you give Pedialyte. You're giving electrolytes like sodium, potassium. But electrolytes are inorganic. So electrolytes, when they use the term electrolytes, are they ions? Yes, they're ions. Yes, but they're derived from inorganic. So this is, once again, lactic acid. It's an organic compound. So when it ionizes, does it form ions? Yes. But they're not. This is not an electrolyte. Okay, so an electrolyte has to be inorganic. So electrolytes are substances, when you put them in water, they're going to break up into charged ions. They dissociate, meaning they ionize. Dissociation is breaking up into ions. So these are acids. Bases. Or salts. So this is where it gets confusing. I'll give you an example, but don't worry about my exams. They're probably never going to ask you this on a nursing exam or on the NCLEX, but at least you'll know the difference between ion is a general term for anything, any substance that has a positive or negative charge. An electrolyte is an ion, of course. It has a charge, but it's derived solely from inorganic substances, such as inorganic acids, bases, and salts. So let's show you that. So let's do an example of an acid. That will be what, then we're going to do some of the general functions of electrolytes, and you can take your break. The first example we're going to do is an acid. This acid is called hydrochloric acid. Your stomach cells, this is produced by, it's a very strong acid. This is the strongest acid in the body. Your stomach cells, the parietal cells, they call parietal, P-A-R-I-E-T-A-L, parietal cells of the stomach. One of their main functions is to produce hydrochloric acid. So your stomach is the most acidic environment in your body. Okay, it has a pH of 1 to 3, and if you recall, we did. I'm going to redo all that. When you have a pH of 1 to 3, you're very acidic, and the stomach is supposed to be a very acidic region. Okay. As a matter of fact, when the acids, the pH goes up and the stomach becomes less acidic, then that increases your risk for infections, because one of the functions of hydrochloric acid is to kill bacteria. So you can see when you take drugs like, has anybody heard of the purple pill, Nexium? Okay, that decreases acid production. So for the NCLEX, what do you think a major side effect of Nexium might be? An increase in the risk of infections. So this is when you hear on TV they advertise all these drugs and they say, well, they don't want you to, it sounds like I don't want to take a drug, it's got so many side effects, I'll die from the drug. But one of the major side effects of it, the risk for infection goes up. Okay, so the parietal cells produce hydrochloric acid, but we're going to put HCl in water, little water, and so what's it going to do? It's going to dissociate or ionize. Okay, so it ionized into what? A cation, which is also known as, if it's an H plus, it's also a proton. This is hydrogen, but it's also called a proton. And Cl negative, the chloride, it's a negative, so ionized into the proton. This is also a cation, right? It's positively charged, and an anion. Okay, this is actually considered these are also considered the electrolytes. But what do the electrolytes do? This is where the difference is. They dissociate. So when the doctor is talking about measuring electrolytes, they're measuring this. All right. So, but now you know there's a slight difference. And because of I separated out a little bit of chemistry from the actual medical application of it. So in general terms, I'll give you another one and then I'll repeat that. Here's an example of a base. I'm going to give you an important base. This base is called sodium bicarbonate. You've heard of sodium bicarbonate. It's in Alka-Seltzer. All right, sodium bicarbonate. And you notice, so we're going to put in a little water. And what is it going to do? It's going to dissociate or ionize. So what did it break up into? Ions. Okay. But more specifically, these are also called electrolytes. Why? Because they came from an inorganic substance. Okay. So these are what you'll be measuring in the hospital when the doctor or you are discussing electrolytes, when I'm testing you on electrolytes, when you're being tested by your nursing professors on electrolytes. This is what you're talking about. Okay. This is what's being measured. Okay. Once again, sodium bicarbonate, okay, which is I'm sorry, that's a salt. I put it here. It went out of sequence. So what did it break up into? A cation. And there's our negative charge. And here's the bicarbonate ion. Keep remembering the bicarbonate ion. So this is a salt. Let's do a base. A base is easy. I'll just do the base up here, and you could add it to your notes. I don't want to erase it yet. There's the base. So what I did, I'll put the base up here. This is sodium hydroxide. I don't really care. I'm just giving it to you to complete it. I'm not going to ask you about sodium hydroxide on an exam. This acids and salts are very important. We'll talk about bases other than sodium in a moment. But when you put this in water, right? So remember, inorganic acids, bases, and salts, when you put them in water, they are going to dissociate. What does it dissociate into? Sodium. Plus the hydroxyl ion, which is an anion, right? So these are what? Ions. This is also an ion, right? Because it dissociated and formed what? A negative, an anion, and a positive cation, hydrogen. But this is not an electrolyte because this is an organic compound. This is going to dissociate into sodium, which is an ion, more specifically a cation, the hydroxyl ion, which is an ion, more specifically an anion, but we take it a step further, they are also known as electrolytes. When you put these in water, all right, they will conduct electricity, okay, hence the term electrolytes. Okay, so once again, when you put an inorganic acid base or a salt in water, it's going to dissociate, and it will dissociate into ions. These ions are also called electrolytes. So you can have electrolytes are always going to be ions, right, because they have charges. But not all ions are electrolytes, because this is a ion, right, the charges, but this is not an electrolyte. Okay, so the electrolytes that you'll be responsible for nursing, for my course, are the ones I put under cations and anions, the sodium, the potassium. Those are the ones that you'll be focused on. Okay, so we're not going to get crazy with this on tests, so I want you to understand the concept, because when I do acids and bases, and especially with pH, you have to understand the concept of ionization and specifically proton, what happens with protons. Everybody got it? All right, so let's take a break now. Okay, I'll give you 20 minutes.
I have a question
Yeah.
before we leave.
Yes.
Do they always break into cations and anions? Do they always break to have a positive and a negative charge?
Yes. They're always going to have either positive or negative. All right.
So you'll never have them have two positive, two negatives.
Oh yeah. You could have phosphate is there. I'm not going to go into chemistry that deep, but if you lose, like phosphoric acid is, if you lose a few hydrogens there, then you could have two charges, just like calcium has two charges. So you can have ions, which I didn't go into yet. That might be at the end or in part 2 when I do the blood in some detail with bones and stuff with phosphate. You could have chemicals that ionize that have 3 charges, 3 negative charges. And we'll give you an example before you take your break, because it's important anyway. And I already did this, and most of you got it right on the test, so I'm very happy. I love when students get things right. That means they understood what I was saying and they studied. This is iron. That's lost 2 electrons. It's oxidation, and it becomes, once again, the ferrous state. If you recall, okay, this could happen with other compounds with negative charges. I'm just giving you this because I want you to know this. If this is the ferrous state or ferrous ion, that means it has Fe2. That's what binds oxygen. Okay, that's the state of iron in your hemoglobin that binds oxygen. That binds oxygen. So we're going to do that in a little bit more detail coming up when we do the red blood cell and stuff, because there are lots of problems that can arise. When iron goes from the Fe2 to the Fe3, what has happened? It's lost another electron. And now that is called a ferric state. Ferric ion, or I'll put state for your notes, I'll put state here for your notes. Okay, that does not bind oxygen. So in all of us, our ions in our hemoglobin is converted to the Fe3 all the time. Okay, so we need enzymes that are going to do what? Right? We need enzymes in our red blood cells because this doesn't bind oxygen. So if we produce this all the time, we're going to have red blood, the hemoglobin in our red blood cells aren't going to bind oxygen. So we need a system, this is chemistry is cool if you start to get into it, we need a system that converts this back to this. And those enzymes are called reductases. And we'll do them. I'm going to give you them when we get to that with blood, with the hemoglobin and stuff. You get that in great detail, as a matter of fact. What do you think reductases? Remember, anything that ends in ASE is an enzyme. What do you think reductases participate in? Reduction. So therefore, let's erase this before you go on your break. If you're producing too much of this in your red blood cell, these enzymes play a major role in converting this back to what? That. So when it goes from Fe3 back to Fe2, that is called reduction, because what has happened? You went from Fe3, 3 charges, to 2 charges. So this has been reduced back to what? Fe2, because now it has what? It only has 2 charges. So this is a gain of an electron. Okay. And so when you go backwards, Fe3 to Fe2, that is reduction, and that is because the you've gained an electron. All right, so you reduced it by 1 positive charge. So these reductases are important in our bodies all the time. Oxidation reduction reactions go on all the time in our body. So when you have oxidation, you also have reduction going on at the same time. They occur simultaneously. So when something is reduced, something else is oxidized, or vice versa. All right, so yes, you could have multiple charges. You could have multiple negative charges. It depends on how many electrons are lost or protons are lost, or how many electrons are gained or protons are gained. So we'll talk about the proton aspect at a later date. All right, so we'll take our break. When we come back, we'll do the functions, general functions of electrolytes, and can move on to the acid base. I'll see you in about 20 minutes. Okay, hello everybody. So does everybody like this online nonsense? I don't really like it. Okay, good. I hate this. I like real-time lecturing so I can interact with the students, and I find it to be a much better learning environment. But we got to make do what we have to do. But as I said before, because of the nature of this, the whole event and the stress, we're going to do it make it as stress-free as possible. So in some ways, it's a positive thing, because it's probably not going to be as stressful for you guys at the end with tests and stuff. So that's good. Well, I know you love tests. I don't know. Okay, so you got to tell me. You see it?
Down across this, right?
All right, so I'll know better when I write, then you can tell me which way that you want me to shift it.
Okay.
Okay, it might be due to light coming in also. All right, let's see. We'll do it that way. See, just tell me. I'll start writing, and then you can tell me which way what part of the board you can't see, because this might be just a change in the sun coming in through the window.
Okay.
All right, so we'll see. Look, we problem solve. Right? That's what you're going to say to me. If you're ever an RN and you're taking care of my patient and something's going wrong, you got to problem solve. All right, let's do electrolytes. I'm up here. Can you see that? You can see the electrolytes? So, okay. All right, so the electrolytes are, once again, are also ions. So we have to remember not all ions are electrolytes, pardon me, but all electrolytes are ions. So electrolytes, once again, are inorganic. There's sodium, potassium, calcium, chloride. Those are all zinc. Those are all electrolytes. And that's what you'll be measuring when the doctor asks you for an electrolyte level. So let's do some of the general functions. And I'll give you some, when I list the functions, I'll give you an example. So some of the functions of electrolytes. Number one, they play a key role in water balance or fluid balance. So we're not going to talk about osmosis and things like that until next week. I'm going to condense some of the chemistry, so I'm going to bypass it. Also, I'm going to give a taped and make it available to you lecture on some of the chemistry stuff. So as soon as I know it's done, I'll email you, and so everybody's on board with it. So fluid balance. The electrolytes that play a major role in fluid balance, example, sodium plays a major role. So I put sodium and I put the abbreviation for it. So whenever you have a change in water balance, you're going to eventually have a change in electrolytes. Whenever you have a change in electrolytes, eventually you're going to have a change in water. So you can't have one without the other. Okay, so eventually sodium and water are always connected. So sodium and water are always interconnected. When you have problems with water, eventually you're going to have problems. Say.
Guys, if you don't have anything to say, just mute your mic.
Okay, so when you have a problem with sodium balance, you're always going to have a problem with water. When you have a problem with water, eventually you're always going to have a problem with sodium. Sodium plays a major role in fluid and water balance, and we'll do that moving down the line. So I'm just giving you examples of some of the functions. Number two. The electrolytes are needed for muscle contraction. So what muscles? These muscles are, I'll put them here. There's three types of muscles, muscle tissue: skeletal muscle, the second type is cardiac muscle, and the third type of muscle tissue is, of course, smooth muscle. Now, I always like to expand the topic and give you a little extra because then it overlaps and you wind up remembering forever. Remember, skeletal muscle is voluntary. That means you control it. When you adjust the computer or your iPad, when you're writing, That's voluntary, using skeletal muscle. My writing on the board, moving back and forth, is skeletal muscle. It all is voluntary. Cardiac, oh, I left out a D. Can't leave out a D. Cardiac muscle is the heart, of course. That's involuntary. You can't control that. So can we influence cardiac muscle contraction? Yes, we can give drugs and stuff. We could give drugs to increase the heart rate, slow the heart rate, but the heart will beat on its own. If we don't do anything, the heart will absolutely take it out of the body and put it on a table. It will beat on its own for a while. So the heart will initiate its own heartbeat. All right, so the heart is involuntary. You can't stop it, start it. Smooth muscle is also involuntary. Can't control smooth muscle. If you recall on your last exam, the quiz where the scores were very good, vasoconstriction, vasodilation of a blood vessel involves smooth muscle. Vasoconstriction is when the smooth muscle contracts and the vessel gets smaller, and what happens to your blood pressure? It goes up. Vasodilation is when the smooth muscle relaxes and your blood pressure goes down. So you have no control over that. That's involuntary activity. That's controlled by hormones, neurotransmitters. But can we influence it? Yes. As RNs, you will be giving drugs that can influence the smooth muscle of blood vessels. So you can give drugs that cause vasoconstriction, which will increase the patient's blood pressure, or you will give drugs that cause vasodilation that will decrease the patient's blood pressure. So as RNs, future RNs, you'll be giving all sorts of medications that will work on various cells to produce effects that hopefully you desire. So muscle contraction. So electrolytes, one electrolyte's essential. There's others, but the one I'm giving you just examples, calcium. Calcium is essential for muscle contraction, both in skeletal muscle, cardiac muscle, and smooth muscle. Without calcium, you're not going to have muscle activity. So when we move further down the line and I start to build on this, this is going to start to make even more and more sense as we add on to your knowledge base. So calcium is an electrolyte. Once again, if you want, I'll add the charges so you don't forget that they're ionized. So another function of the electrolytes, a general function, is muscle contraction. Number 3 is blood clotting. So for your blood to clot, you need an essential electrolyte, calcium. Calcium is also needed for blood clotting. As a matter of fact, when you do a blood test, sometimes you want the blood to clot, sometimes you don't. So in an example, in a CBC, I'll put up here to give you, and I'll bring in, I steal all sorts of equipment from the hospital and stuff, so I'll bring in, while we're here, I'll bring on tubes and stuff. But for example, the doctor orders a CBC. It's called the complete blood count. And we're going to do this in great detail next semester when we do the blood. I start the blood with the Anatomy 2 class tomorrow. We spend a lot of time on blood and heart and lungs. So the CBC is complete blood count. What can you check on the CBC? You can check red blood cells. RBCs are red blood cells. Of course, another name for the red blood cells are the erythrocytes. Erythro is a word prefix meaning red. Red blood cells. You could check the white blood cells. Those are the leukocytes, are the white blood cells. And there are many types of white blood cells. You could also, another thing you check on there's many things, but I'm just giving you a general, because the more you learn, the better. You could check the platelet count. And the platelets are involved in blood clotting. Some books, I'll put it in parentheses with a big question mark. Actually, several question marks. Because you never know, you go out, you go on a date, you're going out and have a couple of beers, you can argue about this at the bar or at the restaurant. Or we can't, coronavirus, they shut everything down. Oh my God. So, platelets. Some books, some of the nursing books might still be calling them thrombocytes. Thrombo means clot. Thrombo means clot. Cyte means cell. But a platelet is not a cell. It comes from a cell. So you can see the confusion that arises because technically platelets are not thrombocytes because the word thrombocyte is saying it's a cell. So, but some books equate platelet and thrombocyte. So just be aware, if you hear the term thrombocyte used with the platelet, just go with it. Don't start saying, you're reading a book, so you can't argue with the book. Say, all right, this is how they're presenting it. But technically, histologically, a platelet is not a thrombocyte. It's derived from a cell. It's not a cell itself. So when you check the CBC, you don't want the blood to clot. So if it clots, they're going to send the specimen or the lab slip back to you and say, you got to draw the blood again. Do you think the patient's going to be happy? No way. Patients do not like, well, some people like to get stuck with needles. I do not like getting stuck with a needle. I don't like the dentist. I don't like any of that stuff. I can give you needles. I can take things out of your body. Don't try to take anything out of my body. That's the way I look at it. And so if the patient's going to be pissed if you took the blood and you let the blood stand for so long and it clotted, the lab is going to say it's no good. So what you do, you put the CBC, when the doctor orders a CBC, it goes in a purple top tube. When you go, or lavender, all right, the nurse is always getting on me, all right. The nurses always tell me it's really lavender. I think she likes me, but she's always arguing with this. But it could be lavender top. I call it purple, they call it lavender. But the point is, when the doctor orders a CBC and you take that patient's blood, you're going to be putting that blood into a purple lavender top tube. You don't want the blood to clot. So what do? What is needed for clotting? Calcium. So you put a little, at the bottom of the tube, you will see a little chemical, a little fluid that has a chelating agent. Pardon me. Chelation.
Professor, can you move it just a little bit over to the right, like towards that way?
Which can't you say? The chelating?
Yeah.
You got it now?
Yeah.
Okay.
Thank you.
So periodically, if I have to adjust it, just tell me so I can move it back and forth. I think some of the things are based on, once again, I keep repeating, on the direction of light. It changes. So yeah, just let me know and we'll take. So chelation means to bind. When something binds something, you're going to be giving, we use chelators or chelation agents all the time. When we do blood, I'll go into it more when you get me for pharmacology. I think I'm teaching pharmacology next semester. So you'll probably have me for pharmacology and anatomy too. But a chelating agent, so if somebody has too much iron in their body, we can give a drug, a chelating agent, that binds the iron, and then you eliminate it from the body. So chelators are used to bind something and then eliminate it. Okay, so in the purple top tube at the bottom, we have a little fluid, and that has a chelating agent in it. Chelation means to bind, and the agent binds calcium. So I'll erase some of that, some of this other. So if it binds this agent, there's different types. One of them is called EDTA. So at the tube, it'll say on the tube, you look at it, this contains EDTA. That's a chelating agent. What does it do? It binds calcium. So when it binds calcium, what can't the blood do in the test tube? Can't clot. So at the bottom of every purple lavender top tube, when you do your CBC, there'll be a little clear fluid. In that fluid is a chelating agent. One of them is called EDTA. It's ethylene diamine tetraacetic acid. You don't have to know that, but know what EDTA is. It's a chelating agent. It binds calcium. When we get to the blood, I'll spell out everything. I'm just giving you examples now. So do you see the importance of, sometimes you want the blood to clot, sometimes you don't want the blood to clot. So when you don't want the blood to clot, you'll add things to the test tube to prevent it from forming a clot. One of them would be EDTA, which binds calcium, which is necessary for blood clotting. All right, so I'm going to, hopefully you got all that. I'm going to erase that. I'll erase the skeletal muscle first. Okay, number 4. Electrolytes are needed for nerve impulses. So we will do of course, action potentials and nerve impulses. That will be towards the end, and that we'll pick that up in next semester in the first few weeks of your anatomy too. But once you get the chemistry down and the electrolytes, this stuff gets a little easier. So action potentials and nerve impulses are how the nervous system communicates. Okay, this is how the nervous system communicates. There are two main ways of communication in the body. We're going to do that in anatomy too. One of them is through hormones. The other way is through nerve impulses. So for example, for my muscle to contract, example, so for an example, this is just an example. We're going to do it in several different ways. And we're even going to do this in infectious disease, believe it or not, or microbiology. When you get me for after anatomy 2 in pharmacology, you have me for one more semester. So a nerve impulse triggers the release of calcium in skeletal muscle to begin the contraction sequence. So this is my biceps, skeletal muscle. For this muscle to contract, okay, to do this, it needs a nerve impulse that comes from the brain and down the spinal cord and all that, but it needs a nerve impulse. Once that nerve impulse gets to the skeletal muscle, what's it's going to do? The end result, it causes the release of calcium, and calcium starts the contraction sequence. So no nerve impulse, what's not going to happen? No release of calcium, you're going to be paralyzed. So strokes, spinal cord injuries, anything that interferes with the nerve impulse to the muscle results in muscle dysfunction, paralysis, or weakness. So nerve impulses are essential way to communicate in the human body. And one of the things they do, they go to muscle so they can contract. Nerve impulses go to the heart so it can contract. Nerve impulses are why I'm talking right now, and you're hopefully remembering what I'm saying. You're remembering what I'm saying because of nerve impulses in the brain. And I hope I start to remember what I say and tell you because of nerve impulses. Control my speech, the movement of my tongue, facial muscles, because of nerve impulses and muscles. So nerve impulses, no muscle contraction. And what's the key electrolyte for muscle contraction? Calcium. Okay. Now, what electrolytes are needed? I'm only going to give you the two, right now, the important ones for our purpose. 2 electrolytes are needed to form action potentials and nerve impulses. So they are, so here, this example here is just reiterating what I just said. A nerve impulse triggers the release of calcium to begin skeletal muscle contraction sequence. But what is responsible for the nerve impulse and the action potential? It's the movement of electrolytes, and that's sodium and potassium. to form a nerve impulse, to form an action potential, and then eventually a nerve impulse, you need sodium and potassium. So remember I talked about hyperkalemia and hypokalemia, high potassium, low potassium levels. I mentioned that we're going to keep building on it. When your potassium is too high or your potassium is too low, it's going to wreak havoc with nerve impulses. Now remember, you need nerve impulses for the heart. So if your potassium level is going to be too high, that could actually cause the heart to stop. Okay, so because it interferes with action potentials and nerve impulses. So another key function of electrolytes, number 4, is the formation of action potentials and nerve impulses. An action potential is just a nerve impulse is just a group of action potentials. What is responsible for the action potential and the eventual nerve impulse? Sodium, potassium. An example why the nerve of action potentials and nerve impulses, that's how our nervous system communicates, by nerve impulses. An example, once again, a nerve impulse triggers the release of that calcium to initiate contraction sequence. So you're going to be given, and we're going to get back to this because there are many drugs that you're going to give that can wreak havoc with human physiology. And this is going to start to make beautiful sense when I build on it in future courses. All right, number 5 I'll put up here. Okay, calcium is also a key component of bones, a structural component of bones and teeth. Bones, teeth. So we always, when we hear about calcium, I think most lay people, I no longer consider you lay people. You are going to be RNs, nurse practitioners, professors someday. So we have to get away from thinking that calcium, the most important function of calcium, is the skeletal system, osteoporosis, all that. Of course, it plays a key role in that. But calcium has many different functions. So I gave you them at the end. I'm going to relist the calcium functions because it's very important. Calcium, number 1, we said was needed for muscle contraction of all muscles. Skeletal muscle, cardiac muscle, the smooth muscle, for example, in your blood vessels. Calcium is needed for blood clotting. You don't have calcium, your blood's not going to clot. Okay. Number 3 with calcium is it's a major structural component of our bones and teeth. So if you have a deficiency of calcium, your bones are going to be, you'll develop either osteomalacia, which is softening of the bones. Osteoporosis is weakness of the bones. So we'll do all that. Okay, but you're starting to see the importance of calcium. Okay, so that'll take us to, I'm going to erase this. So we're on 5. And we're going to do 6. And some of the electrolytes act as intracellular messengers. Intra means within. Cell, of course, means cell, and messenger is self-explanatory. It's delivering some sort of, I'll do circular reasoning, some sort of message or communication. Okay, so what does this mean exactly? This means intracellular messengers can activate or control cellular activity. So they produce a response by the cell. They produce a response. They either cause the cell to do something or not do something. All right, so the messenger has to be inside the cell. So an example, a perfect example of an intracellular messenger is calcium. Oh, I've been using EX. Calcium can also act as an intracellular messenger. Another example would be cyclic AMP. Cyclic AMP is a secondary messenger. When we move further on, we're going to learn that there are enzymes. Cyclic AMP is going to do something in the cell. It's going to turn something on or off. So there are enzymes that will interfere with that. There are drugs that interfere with the enzymes. Let's see. You've heard of the erectile dysfunction drugs. Viagra, Levitra, Cialis. These drugs are called phosphodiesterase inhibitors. These are type 5 inhibitors. We're going to do that. Don't worry, you're going to know this beautifully. But the point is, these drugs allow this to increase in the cell. When you allow that to increase in the cell, it will cause the cell to do something. So these drugs work on intracellular messengers. So we're going to learn all about that. That's why we're spending a little bit more extra time on some of the chemistry. So when you... This is a cell. Not all your cells look like this. Remember, cells have different shapes from anatomy the first week. On the cell, you have a receptor. Now, this is essential. So every time I believe in geometric learning, I give you a brief outline of something else. So when we get to this in detail, you already had it. Okay, and I'll keep reiterating it. So what we're doing is we're talking about intracellular messengers. We want the cell to do something. But now here on the cell, this is the cell. Let me erase. That's too big, that receptor. I like it a little small. There's another receptor, here's another receptor. So on this receptor, something's going to bind to it. That we want this cell to do something. Right? It doesn't matter right now, but we want it to do something. So we have to have a form of communication. Now remember, if you recall, the first way the body communicates and causes cells to do something is through what? Action potentials and nerve impulses. That's one way the body communicates, a major way. So once again, you have a stroke, any type of spinal cord injury, any type of injury that interferes with nerve impulses, you can become paralyzed, your heart can stop. Also, you can't go to the bathroom. You need nerve impulses to tell the cells what and what not to do. We have another system that communicates, and you should remember that. That is the endocrine system. So I'm going to erase this now. The endocrine system is the second major system that is involved in communication. The first is the nervous system. How does the nervous system communicate? Nerve impulses. How does the endocrine system communicate with other cells? Through endocrine glands, which release hormones. Endocrine glands, by definition, if it's endocrine, it's going to release a hormone. Exocrine glands, which will do exocrine, that will be part, exocrine and the epithelial tissue, the tissues, that's going to be a taped lecture you can watch whenever you want. You have to watch it. It's going to be a makeup, but it's going to be taped, so you can look at it at 12 o'clock at night or whatever, at your leisure. That will be coming out soon, so I'll tell you about that. Okay, so everything else forward, we're moving with live, but some of the things that we missed, I have to tape. Otherwise, we're coming towards the end of the semester. So I will tell you, but the tape lectures are just general, straightforward, and you could watch it and watch it and watch it. So, exocrine. These glands do not produce hormones. So exocrine glands, sweat glands, what do they produce? Sweat. Mucus glands, what do they produce? Mucus. Salivary glands produce saliva. These are not hormones. These are secretions that are going onto body surfaces, in the lumens of organs or the surface of organs. So these are not endocrine glands. Okay. The endocrine glands, which comprise the endocrine system, secrete hormones. Hormones, by definition, are chemical messengers. Hormones are chemical messengers that influence cell activity. In other words, once the hormone gets to the cell, it's going to cause the cell to do something or not do something. So that's what a hormone is. The second definition of a hormone, it enters the blood, because it has to go, hormones travel from the head to the toe or all over the body. So to be a hormone, it enters the blood, travels in the blood. The blood is our major transporting medium. Everything is transported in the blood, right? Glucose to the brain for energy, to muscles for energy. The blood transport goes to the kidney so you can get rid of waste products. The blood carries oxygen. So the blood is it's an intravascular fluid. Remember the intravascular compartment? The blood, you mess around with blood, you mess around with a lot of body functions, because one of its key functions is to transport things. So the hormones enter the blood and they travel, so it's released from the gland, it enters the blood and it goes to different cells. Here's a cell. Okay, I'm going to erase cell receptor now so I can, and here, so I'll put CR, cell receptor, there. So I put it there so we don't lose sight of it. This can be a hormone. So that's our hormone. It just came from a gland. It could be the pituitary gland, the thyroid gland, the adrenal gland. So once the gland secretes the hormone, it enters the blood and goes all over. So it goes to this our one particular cell. The hormone then has to bind to the receptor. Once it binds to the receptor, it will do something, because you remember this hormone is what? It's a messenger. It wants the cell to do something or not do something. Once the hormone binds to the cell receptor, it triggers things to go on in the cell. So this will activate, once the hormone binds to the cell receptor on the cell membrane, it will activate secondary messengers. So this will activates intracellular messengers. We're not going to do them now. Of course, that's when we do the endocrine system. But an example of an intracellular messenger would be calcium cyclic AMP. Once this happens, you activate something in the cell. So what was the job of the hormone? To activate something in the cell. And that something is an intracellular messenger within the cell. Once you activate that, that is what produces a response to whatever that cell. And this will result in a biological response by the cell. So that could be contraction of muscle, smooth muscle. It could be something with the heart. But it's causing the cell. It can be turning on protein synthesis in the cell. So that's what I mean by biological response. So are secondary messengers important? Yes, because they have to be activated by the primary messenger, which would be what? The hormone. The hormone would be the primary messenger. It just came from a gland, travels in the blood, gets to the cell where it has to get to, and on the cell there's a receptor for that hormone. If that receptor is not for that hormone's not going to work on that cell. It has to be specific. Once that hormone binds to the cell receptor, triggers things to go on in the cell. That is the activation of secondary messengers. Okay. Those are the intracellular, I'll put here. These are the secondary messengers. And they will result in the biological response by the cell. That could be, I'll just give you examples. Muscle contraction. I'll give you another example, protein synthesis. There's many others, but so you're starting to see how this works. So calcium plays a key role as one of the secondary messengers. So calcium's just not about bones and teeth. Calcium's about what's going on inside your different cells. All right, so you have the hormone binding to the receptor of the cell. Once that happens, you activate something inside the cell. Okay, that then results in a response by the cell. This is how hormones... So what if you give a drug? I'll use a different color. Hopefully it comes out. I'll use... You will be given drugs that can actually bind to the receptor, So the drug you give can actually cause that cell to have a biological response, or the drug you give might stop the biological response. So this is how medications or drugs that you will be given as future RNs work. That's one major mechanism. They have to bind to the cell receptors, because remember, it is the cells and their activity that are responsible for us living as an intact human being. So we can influence, just like the nervous system and the endocrine system can influence cells to do something or not do something, we as healthcare providers can give medications, can do the same thing. We can turn a cell on or turn a cell off. All right, so you're starting to get a good idea. Intracellular messages produce a response by the cell. Examples of intracellular messages: calcium, which is an electrolyte; cyclic AMP, which is a nucleotide. We'll do that at the end when we're ready for the last week of class. And a biological response by a cell is muscle contraction. You want the cell to make more proteins, and that's an example of biological response. We'll get back to this in the first few weeks of semester 2 in big time, so at least you've been exposed to it. And let's now continue with number 7.
Professor?
Yes.
Question.
Can I erase this? Go ahead.
Real quick, up at the top it says primary messenger on the top left. What's before that? Is that one?
Oh, it's a 1 with a little circle, a degree circle, meaning primary. So,
Okay, awesome.
just so people... Sometimes you'll see that a 1 with a little circle over its primary, 2 is secondary, 3 is tertiary, and 4 is quaternary. I'll write them for those of you not used to this. Okay, let me erase it. Intracellular messengers here. So you might see these terms, like, for example, in a sexually transmitted disease, syphilis, which is caused by a spirochete, a bacteria called Treponema pallidum. And we're going to do that in an infectious disease. But this disease, syphilis, is in stages. You could have primary syphilis, secondary syphilis, and tertiary syphilis. So if you have tertiary, you don't want a sexually transmitted disease to begin with. But God forbid I'm told I have tertiary syphilis. I'm not going to understand that, because it destroys the brain. It produces complete destruction of, you have no cognitive abilities. So tertiary syphilis will result in premature dementia. All right, so even if you're telling me, Dr. Farrington, I'm sorry you got tertiary syphilis, I would probably be smiling and thinking about birds or something. All right, so, but many diseases are primary, secondary, and tertiary forms. Syphilis is a good example, because you're going to hear a patient has primary, secondary, tertiary. Tertiary is a late stage, and there's a lot of neurological destruction to the brain. Okay, so those are the terms that are associated. You'll see them quite often.
And one last thing, did you say that a drug would be an example of a primary messenger?
Yes. A good question before I move on, but here's the cell. There's the cell receptor. Anything that binds to the receptor is called a ligand. So a ligand is a chemical that binds to a cell receptor. So a ligand also means to bind. It actually means it's a derivation of lobster claw. Ligand, so a ligand is a chemical. And what it does, it will bind to a cell receptor. So examples of ligands, which that's a good question, and because we're going to do it in pharmacology and anatomy too. Examples of ligands would be hormones. That would be an example of a ligand, a chemical. So a ligand is just a general term, but you're going to hear about ligand blocking and stuff like that, so you might as well know the definition of the word now. Another example of a ligand would be neurotransmitters.
Professor, you're frozen.
What?
Never mind.
Neurotransmitters. Remember, these are the endocrine system and the nervous system are the two main ways the body communicates to the cells. Okay, another example of like medications, drugs. So many of the medications, good question, that you give will be ligands, that's the definition, and they bind to the cell receptor. So they work just like the hormone or neurotransmitter. So when a ligand, a drug, binds to the cell receptor, that will either turn on intracellular messengers or inhibit it. So you can see how drugs can influence what's going on with the cell. Other examples, toxins and poisons. All right, so we did toxin, I believe. Did we do toxin? Toxin is anything that works like a poison and causes abnormal function. Did I give you the definition of poison?
We went over it, yeah. No.
Yeah, just briefly.
Yeah.
A, a poison is any substance that causes abnormal function. So when a poison enters the cell, it's going to immediately produce abnormal function of the cell. This could be the respiratory system, you stop breathing. This could be the GI system where you develop diarrhea, or if the poison is extremely powerful, kill you. Like cyanide, arsenic, and I can poison you slowly or a few months. If I ever ask you to go to, let's go out for I want to give you Gatorade, means you pissed me off. So I could kill you slowly over months, or I can kill you immediately over seconds. Some poisons work in 2 minutes or less, depending, just like venoms from snakes and certain types of frogs. These things will kill you quickly. So a poison, by definition, is anything that causes abnormal function of the body. It could be say it again? Is everything all right?
Is real. I think he had his mic on. Hi, class.
All right. Ooh. Hillary?
Hello, Tito.
Oh, okay. So,
Hello.
hi, Hillary.
Hi.
So once again, a poison is any substance that will cause abnormal function. So poisons can act quickly, such as arsenic, cyanide. That we used to use cyanide for lethal for executions. We use cyanide gas, but Then we have something called toxins. By definition, toxins are usually they're poisons, but they're usually produced by living organisms like bacteria or snakes. So poisons or toxins are poison. They work like poisons. They cause abnormal function. So So a toxin can bind to the cell receptor. This is how the viruses, well, next week you're going to get my coronavirus once I do the lecture with all the updates and everything. But this is how bacteria, many bacteria, viruses get into the cell via cell receptors. So if you can't get into the cell, for a virus to survive, it has to get inside your cell. A virus, the coronavirus, the influenza virus, the measles virus, the mumps virus, they all need your cells to survive. And in able to do that, they have to get into your cells. How do they get into your cells? First, they have to bind to cell receptors. So that's a ligand. A ligand can be a hormone, neurotransmitter, medications that you'll be given as future RNs, which I'm going to do in great detail in pharmacology, and toxins and poisons can be ligands. Okay, so a poison is any substance which causes abnormal function. The abnormal function can be mild. You could have vomiting or diarrhea, or they can stop breathing. Toxins are substances that are released from, this is a strict definition, it's not in your book, but toxins are released by living organisms, and they work like poison, so they'll cause abnormal function. Most of you heard of botulism. Botulism is caused by the bacteria Clostridia botulinum, which releases a toxin, and the toxin works on the nervous system. So toxins work just like poisons. We make antibodies against toxins, and we'll do that at a later date. What is a toxic or toxicity? Since we're on that topic with the toxicity is when a substance reaches something called a toxic level and works like a poison. So anything in nature, if it reaches a critical level, a toxic level, or it's called the critical level, but as RNs, you're going to be taking blood tests to measure therapeutic ranges for drugs, because if you go too high, you reach a toxic level like digoxin, those type of drugs. So anything, if it's taken in abundance, will reach a certain level where it's going to start to act like a toxin or a poison. That's what they mean by toxicity. So when you have toxicity, you have something in your system that's causing it to now work abnormally, because it's the definition of a toxin. But remember, too much vitamin C can reach toxic levels. If it reaches toxic levels, what are you going to start to see? Signs and symptoms of toxicity, abnormal function. Water. There's a condition called water intoxication. Water intoxication occurs when the ability of the body the patient drinks so much water, it's overwhelming the kidney's ability to eliminate it. cells of the brain swell, that's abnormal function. So I'm not telling you not to drink water. I'm just saying, I'm not telling you not to take vitamin C. But anything taken, Americans are famous for it. Well, if this much works, if this much Tylenol works, I'll take even more. Well, if you take too much Tylenol, acetaminophen, that'll reach toxic levels, and then it'll become hepatotoxic. So hepatotoxic, if you recall, hepato means what? Liver. Hepatotoxic means toxic to the liver. The liver is going to start to malfunction. So if you take too much Tylenol, it'll reach toxic levels where you'll develop toxicity. Abnormal function, if the Tylenol becomes hepatotoxic and your liver can shut down. Abnormal function. All right, so Tylenol, acetaminophen is an over-the-counter drug, which is considered to be benign, which it is, but it probably should not be given to patients with liver disease, right? Because why? It's hepatotoxic. Tylenol in excessive doses can result in liver failure. So anything, when it reaches a toxic or a certain level, toxic level, can then start to work like a toxin or a poison. All right, so that was a good question. Okay, and so ligands bind to the cell receptor. Once you do that, that can alter the function of the cell in a good way or a bad way. Medications, when they bind to that cell receptor, can cause the cell to do something or stop the cell from doing something. That might be what we want. Toxins and poisons, once they bind to that cell receptor, they're going to produce abnormal function. All right, hormones and neurotransmitters, once again, when they bind to that receptor, they will either cause the cell to do something or not do something, which I erased, but you already have that. So this is an important concept, which I brought, look at, I brought it back. You're going to get it again next semester in pharmacology. Okay, this is an important concept with medications, because if you give too much medication, reaches toxic levels, and what are you going to see? Abnormal function. So the RN will check for signs and symptoms of abnormal function. Okay, good. All right, we're going to take a break, and then the last part, I'm going to finish. I'm just going to list it, the other two main functions of electrolytes. Then I want to start the basic acid and bases, and because this is a hot topic. So I'll see you shortly. Okay. Everybody with me? Can everybody hear? Okay, good. All right, for the last hour, I'll give you a coronavirus update. The signs and symptoms. Now, see, as RNs, you got to learn how to put signs and symptoms in the right perspective. For example, because we're talking about toxicity, now you know what I think about when I go on the break. Vitamin C, too much vitamin C. Vitamin C is very good for you, but if you take too much vitamin C, it can cause a non-serious toxic effect such as anal itching. So it's a little known fact, but I'm into biochemistry, so I pick up these little facts. I'm not saying with itching or pruritus, pruritus is the medical term for itching, and pruritus can be something not serious or something very serious. So it could be a sign of liver disease, malignancy. So I'm not saying every time you scratch your behind you run for a CAT scan, but what I'm saying, if you're taking 3 grams of vitamin C a day, you might find yourself scratching your behinds. That doesn't mean you have cancer. So I like to give you extremes, but toxic things, when things build up in your system, they're going to start to produce signs and symptoms, no matter what it is. Okay, so the coronavirus, they say, Corona, of course, is the initial signs and symptoms which you have to be alert to is a very high fever and, of course, shortness of breath. But there's some earlier symptoms that are non-respiratory related. That includes diarrhea and GI symptoms. Also, loss of taste and smell. So these are these are different systems. The epidemiologists are coming out. That doesn't mean everybody that has corona is going to display this, but some people who have sudden diarrhea or runny nose, this should just alert you that you might be infected. Sudden loss of taste, sudden loss of smell could also herald that or be a harbinger of a coronavirus infection. Most people with corona are not even going to know they have it, and most people with corona are going to survive it. So we're going to get through this. So I'll keep you, when I do the lecture, you can check out all the vaccines I'm going to do and the medications. Let's finish this, then start acid-base and get you through the day, and then we can pick this up next week. Yes, I'll notify. We're going to do this every week. The Tuesday we've combined with the Wednesday. So I'll notify you every week, but just thank you for asking. Yes, we're going to do this every Wednesday at this time. What was the time today? 10, yeah, at 10 o'clock.
Okay, cool, thank you.
You're welcome.
Sorry, when are we gonna start the lab, like after you finish this?
No, this is combined because I added time onto it. So once I finish this today we're just going to go to around 2-ish. Yeah, so that's going to cover everything. Okay, so you notice we didn't take a lunch or anything like that. We just took a couple of breaks just so I can get you guys away from the screen and things, because for some people looking at a screen for too long precipitates headaches, and you start to get antsy in your chair, and it's counterproductive to a good learning process. So I do not like the screen for too long. It's one of my personal peeves, but I know many students also feel the same way. So I'm just treating it in a general way. So once again, we're trying to make the best out of everything. But yes, to your question, every Wednesday at 10. But I will keep you every week. I will notify you before. Okay, so let's finish the electrolyte functions. I believe I was at 6. Was I at 6? Yes, I was. Let's do the last one. So what we did, we defined an electrolyte. Electrolytes, by definition, are ions, but they're inorganic ions. Electrolytes can be cations, positive charge, anions, negative charge. Electrolytes form when you put an inorganic substance into water and it breaks up into charged components. A positive component, a cation, a negative component, an anion, ions. Something can be an ion and not be an electrolyte by strict definition. I gave you 2. Lactic acid, when it dissociates, it forms lactate. That is an ion, but it's not considered an electrolyte. Pyruvic acid, when the ick becomes an 8, so when pyruvic acid becomes pyruvate, it has now become an anion, right, the pyruvate, and then it gave off the cation, the proton. That is not an electrolyte. So an ion is a charged substance, positive, negative. An electrolyte is an example of an ion, but it is also is derived from an inorganic substance. So when we talk about electrolytes, and don't get that wacky when you in nursing courses and yes. Everything all right? We're going to do number 7. Okay. So electrolytes can act as cofactors for enzymes. And once again, enzymes are biological catalysts. They're very important for chemical reactions. So enzymes are necessary for many chemical reactions that go on inside the cell or inside the body. Many enzymes need something called a cofactor. So the enzyme will not work well or at all if you don't have its cofactor. So cofactors are usually electrolytes, or vitamins. So cofactors, you can readily see when you have a deficiency of a certain ion or electrolyte or a vitamin deficiency, that will interfere with many chemical reactions going on in the cell, because many enzymes in the cell to perform that chemical reaction in the cell will require for its normal function a cofactor, a teammate that is necessary for it to fulfill its chemical function. So electrolytes and vitamins. I'll give you one example. Why? Because this equation is going to loom up for the rest of your careers, especially in school, your academic. So let me give you the equation. This is going to be very important with acid-base problems in blood. This equation is going to be very important in the lungs when we do respiratory. So this is an important, if I want you to remember one chemical equation, it's this one. Okay. All right, this is an equation that goes on in, for example, in your red blood cells. So it's for this event to occur, this reaction to occur, it has to occur rapidly over seconds. If you didn't have this enzyme and its cofactor, this would take minutes to hours, you'd be dead. So the importance of an enzyme is, the presence of an enzyme is very important for this chemical equation to occur. This is carbon dioxide. This, of course, is water. H2CO3 is carbonic acid. That's going to be very important when we do metabolic acidosis and alkalosis and all the other. This is, of course, is a hydrogen. This is a ion, right? It's got a charge. More specifically, it's a cation because it has a positive charge. And even more specific, it can be called a proton because the only element or ion with a charge, one charge, that can be called a proton is hydrogen. Okay, so hydrogen is also known, I can't keep stressing it, is a proton. Gotta keep saying it. Hydrogen can, H plus can be called a proton or vice versa. HCO3 is, once again, I'm going to rewrite it because I want you to know it, is called a bicarbonate ion. Now, any chemical stuff I'm going to do in live lecture time so you could have questions. As I said, some of the material that we missed that it would just require book reading, but I'll lecture on it, is like tissues, histology, and things like that. I will have that up. I'll let you know. I'll shoot everybody an email when it's up and running. And that will be some makeup material that it will lend itself to simply looking at it. You can look at it several times and then just looking in the book. The chemistry stuff I'm not going to, or some of this other stuff I'm not going to leave you hanging. I want to be here in front of you live in case you have a question. So you got to know, you have to know, my mother, God, oh my mother would love it, is the bicarbonate ion. Okay, this is an important chemical reaction. Okay, so what does this reaction require? For this, and these arrows means it goes both ways. So it's a reversible chemical reaction. It can go this way or it can go this way. So that's when they have arrows pointing in opposite directions with a chemical formula. You know you can go either way. So the enzyme that's necessary for this whole thing is called carbonic anhydrase. That's the enzyme. We know it's an enzyme because it ends in what? ASE. You're going to hear about carbonic anhydrase in pharmacology because there's medications that are used as diuretics, and they're also used for a high altitude mountain sickness. They're called carbonic anhydrase inhibitors. So that means these medications inhibit that enzyme. So this comes up. It comes up in pharmacology and anatomy too. So I want you to know this reaction. That's the enzyme that's necessary for this reaction. But this enzyme, and once again it's an enzyme because it ends in ASE, this enzyme needs a cofactor for it to work at its optimum level. The cofactor is an electrolyte, and that is called zinc. So zinc is an essential, one of the functions of zinc is to function as an essential cofactor for the enzyme carbonic anhydrase. If you have a zinc deficiency, that will then interfere with the functioning of the enzyme. So you're starting to see the importance of having deficiencies in certain electrolytes and vitamins. That will interfere with enzymes and secondarily chemical reactions. So electrolyte imbalance, sodium, potassium, zinc, calcium can wreak havoc on the body. So that's why I separated out, if you recall, when we did fluid balance, composition of the blood, glucose, creatinine, I separated the electrolytes out and treated it as a separate topic. As RNs, as part of the healthcare team, one of the key functions in a patient is maintaining fluid balance and electrolyte balance. This is what we're talking about. So now we're going to get out of here and we're going to move to acids and bases.
Real quick, would zinc be used on both parts of the equation, like the arrows?
Yes.
Or just
No.
the first one?
The enzyme, I just drew it there because I ran out of room. The enzyme's needed for both the forward and the backward. So,
And for both
and
parts?
the zinc too, yes, for both parts. So in other words, I saved myself time, but that's a good question. So for going this way in that equation that I just wrote, for when you go from CO2 plus H2O carbonic acid, then hydrogen plus bicarbonate ion, the proton, zinc, carbonic anhydrase is needed. Also the zinc. For it to go backwards this way, all right, when you go from the bicarbonate ion, the hydrogen proton, to form carbonic acid, and that can dissociate, okay, into CO2, break up into CO2 and water. That requires the enzyme and also zinc. So zinc and carbonic anhydrase are required for both the forward and the backward reaction. So very important chemical reaction, very important. There's a few other ones that I'll give you as we move on, but once you start to understand the concept, it becomes relatively simple. But this one, you got to remember the whole thing, all right, because it plays a role in acid-base balance, because we're going to see control of certain substances in that equation, like carbon dioxide and the bicarbonate ion, influence whether you're going to be in acidosis or alkalosis. So that equation is very, very important. But to get to that point, we're going to start acids. I'll keep it simple for your next exam, and I'll discuss the exam. I'm going to discuss it with the dean. I don't know what the testing method will be. This is a stressful time, but my goal is to make sure you learn, you're comfortable, and you retain what you learn, and you can apply it in your careers. So my goal is to make you learn under as a stress-free environment as possible. So we'll discuss tests. When I work it out, I will certainly let everybody know. But now let's do what an acid and a base is. And very simple. Now, there are several definitions of acids and bases. We're just going to do one. And the first is the first definition of an acid. This is the Bronsted-Lowry. Okay, I'm not going to ask you this, but this is called the Bronsted-Lowry definition of an acid. They'll never ask you that, so I don't care if you remember it. But for medicine, this is the definition you have to know, what an acid is. An acid is a proton donor. Once again, what is a proton? I keep saying it. This is why a proton is an H+. So a key definition of an acid is that it gives off its protons, its hydrogens. So I'm going to give you a definition. Or an example, HCl is hydrochloric acid. This is a very strong acid. So it completely dissociates. So that means when you put this, for example, in water, hydrochloric acid is going to dissociate into, there's a proton, right? That's what the acid is. It's going to donate a proton. It's going to get rid of it, and that proton is going to be released into the body fluid. It can be picked up by another substance, but the acid's giving it off. Okay. So an acid is a proton donor. Strong acids completely dissociate. So they give off all their hydrogens. So this is a very strong acid. When you put it depends on how much hydrochloric acid you put into a beaker. It's going to give off all its hydrogens. This is an important point which I'll get to momentarily. Then you have a weak acid. This would be, now remember that equation, this is carbonic acid. H2CO3, remember part of that equation? I'll put it up here. So, to reiterate my answer to you before, when the equation is going from left to right, you need carbonic anhydrase and zinc. When the equation is going from right to left this way, you need carbonic anhydrase and zinc. This is a very important chemical reaction, especially with a hard topic like this. So carbonic acid, once again, what is this? Carbonic acid. Carbonic acid is a weak acid. Hydrochloric acid is a strong acid. So when we put carbonic acid in, for example, water, it's going to dissociate. It's going to form ions or electrolytes, right? Because this is inorganic. So there's our proton, because what's an acid? An acid is a proton donor. So there's our protons. Here's our protons. But it's also going to produce right? So it didn't give off all its hydrogens because one of the hydrogens are where? Still connected to the bicarbonate ion. So this is the bicarbonate ion. Right? And that's part of what? Our equation up here, which is very important to remember. So there's very little I expect you to remember as far as the chemistry with some of the formulas. But if you're going to understand respiratory acidosis, alkalosis, metabolic acidosis, alkalosis, you have to understand this basic formula and some, like the H pluses, the hydrogen protons, and the bicarbonate ion, essential. Okay, so I'll erase this here. And this is, of course, the bicarbonate ion. Okay, this is an anion, negative charge. This is a cation, a positive charge. This is an ion. This is an ion. Negative ion, positive ion. Anion, cation. This is also known as a proton. Okay, so carbonic acid is considered a weak acid. So it will not completely, in case you can't read it because I got squeezed out here a little and my writing got smaller, it does not completely dissociate because where is one of the hydrogens? It's still attached there. So it's not a free proton. So it makes it a weak acid. So the stronger the acid, acids are not defined by how caustic or how much damage they can do to tissues. Acids are defined by how many protons they donate to a system. Okay, it is actually the protons that can do the damage to tissues and such. They bind with the proteins and stuff like that. So strong acids give off all their hydrogens, their protons. Weak acids only give off some of them. They don't give off all of them. This is an important point. I'm going to move on. I'm not going to, because I don't want to kill you with this stuff. I want to give you the basics. So by next week, I'm hoping you'll reread what I've given you, and we're going to do some hard concepts. But so you have an acid is a proton donor. So if we put a strong acid such as hydrochloric acid into a beaker of water, it's going to completely dissociate, just give off everything, all its hydrogens that it has. Okay. Carbonic acid doesn't. It's a weak acid. It's only going to give off some of them. Okay, now a base, I'm just giving you what a base is right now. In medicine, we're concerned with pH problems with the amount of acid, protons. So you don't have to get crazy with base and remember all the base alkaline things. But a base, I'll put it here, if an acid, in our definition, if an acid is a proton donor, then a base is a proton acceptor. So acids say, hey, I want to get rid of my protons. That's the definition. If it's strong, I'm going to get rid of all my protons. If it's weak, I'm only going to get off some of my protons. Bases are the same thing. Bases say, all right, come out protons, we want you. So a base accepts you. So when a proton binds, H plus binds to a chemical, that is the definition of a base. So a base accepts protons, acids get rid of them. Okay, so we're going to just leave that there. Okay, because right now you'll reread these notes. Let's do with pHs one more time. I'm going to erase this. I could erase this now. And let's do pH. The pH is mathematically something called the, oh, you're doing math, right? You're doing logarithms and all that? The pH is the negative log of the hydrogen ion concentration, protons. When they say hydrogen ions, it's the same thing as saying a proton, right? Because an ion is positively charged. So that's the mathematical way. P stands for potential for hydrogen. So I'm not going to give you any logarithmic problems on it. This is not a chemistry course, so you don't have to worry about me giving you logarithm problems. I want you to understand the concept, the biological concept, not the mathematical. I'm not going to get crazy with this. So what the pH really measures is it measures the amount of hydrogens in a system. And when I say by hydrogens, it's protons. And by the way, in chemistry, in case I keep forgetting that some of you that had chemistry, brackets, when you talk about, means concentration of. So when you have in chemistry, when you have a X surrounded by brackets, that means the concentration of X. If there was a Y there, it would be the concentration of Y. So when you, in a chemical reaction or any chemical formula, as soon as you see brackets, it means concentration of. So what we're doing when you measure pH, and you can measure the pH of any body fluid. Example, I'll just give you some examples. Next week I'll give you about 10 examples of pH of different fluids. But you can measure the pH of any body fluid. That means blood. Saliva. Gastric secretions. You could measure the pH of the skin. The skin produces all sorts of fatty acids, so the skin has an optimal pH, about 3.5 to 5.5. So the skin's pH, if you maintain, has a major antibacterial effect. So when if you use the wrong soaps, you change the pH of the skin, you can increase the risk for actually certain types of bacterial infections. So the pH of vaginal secretions, pH of semen, pH of tears, the pH of synovial fluid in the joints. I'll give you some of those next week. So any body fluid, you can measure the pH of orange juice, of milk, water, any fluid you can measure the pH of. So when you measure the pH, you're checking to see if the fluid or solution is acidic, basic, or alkaline, or is it neutral? All right, the only neutral fluid is water. All right, so the pH of water is distilled water, not water with electrolytes. The water from your in your bottles and from your tap is not distilled water. It's not pure water. A substance is added to it intentionally, and some substances not added to it intentionally. Lead, things like that. So the only neutral substance is distilled water has pH of 7. So any body fluid, or any fluid, but any body fluid, because we're talking about human physiology, has a pH. Is it acidic pH or is it an alkaline pH? We usually refer to alkaline, not basic, when we're talking about the body. So let's take this here, okay, and to show you now, we can invert, it's a negative log, so we can do a simple algebraic manipulation. All right, so the pH actually could change this around. Is 1, right, which is for our purposes a constant now, 1, right, over the hydrogen ion or proton concentration. So watch how this changes, because I'm going to show you in several different ways. You understand the basics, and that's when we're going to call it a day before we start some of the heavy stuff next week. So we can manipulate this formula to come up with this formula. Now what I want you to see now, we said the acids give off hydrogens. Strong acids give off lots of hydrogens. Weak acids only give off part of their hydrogens. So if we have here let me see if I could use I got to get these color pens here. If we have an increase, oh, that looks pretty good. If you have an increase in hydrogens in your blood, for example, increase in hydrogen protons, right? Now, simple math, right? Your math course. If you have an this is called inverse proportionality. If your denominator goes up, right here, your variable what has to go up? Down. Okay, does everybody see that relationship? So when you have a decreased pH, I'll put it up here, that means you have an increased number of hydrogens. This is so important because then we're going to tie it to the scale, and that's where we're going to probably end it up. Now I'll use another color if I have it available. I'll try the green. Oh, you know what I'll do? I'll use a whole separate formula. So this I'll put here is going to represent a condition called acidosis. Okay, I didn't get to that. I got a little ahead of myself, but just put that in front of that. So that's what that condition, this change represents, acidosis. Now, let's do the formula again. So this is what nurses, doctors, you're worrying about the hydrogens. We're not worried about the bases as much because it's relative. If you have a decrease in hydrogens, you're going to be more alkaline. Increase in hydrogens, you're going to be more acidic. Okay, so now let's look at this. If these go down, the amount of, remember brackets means concentration. So if the amount of hydrogens in your blood go down, it could be your joint fluid, but we're starting with blood, arterial blood, because I asked you that on your last quiz. So if the hydrogens go down, what has to happen to the pH? It has to go up. It's inverse proportionality. So that means you have an increase in pH. So that means if you have an increase in pH, that means you have a decrease in hydrogens. Okay, that would be then called a condition of alkalosis. So this would be okay, so I put it in one way. I put it in the second way. I'm going to do the pH scale one more time, and then I'm going to use, once again, arterial blood, and that's where we're going to wrap it up, because I don't want to kill yous. I'm sure your eyes are starting to glaze over with this stuff, some of you. Okay, so I'm going to erase this. And so we're almost through. All right, this is the pH, I rate pH. This is a pH scale. This is a vertical one. Many books will give you a horizontal, saying it's the same thing. So this is a pH scale. So all body fluids, if you, I did this in high school chemistry and college chemistry, all body fluids or any fluid in nature, you can measure the pH. Meaning, is it the pH of this solution or sample acidic? Is the pH going to be basic or alkaline, or is the pH neutral? Neutrality is limited to distilled water. So when you have a pH of 7, that is neutrality. Okay, you have a neutral pH. Now, so once again, I'll put here pH scale. Now, when you go down, start in this direction. So we'll start at 7, but it can start actually higher up a little. We'll explain that. When you go down the scale, so your pH is getting what? Lower, right? You start at 7, and 6, your pH of 5, pH of 4, pH of 3, pH of 2, pH of 1. When the pH is going down, you see it? I'm giving you 3 different ways. I'm going to finish it with the 4th way, so you notice. When your pH is down, what do I know is happening? Hydrogens are going up. So when the pH is going this way on this scale, you have an increase in hydrogens. You have a decrease in pH. And you are moving towards, or you're in, acidosis. Right? Because the more hydrogens you have, the more acidic you are, because what do acids do? They give off their hydrogens or their protons. Okay, there's our proton. If you're going up the scale, you have a decrease in hydrogen. Let's look at, right, when you have the pH is going up, that means you have a decrease in hydrogens. Okay. So, an alkalosis, okay, because you're moving towards basic. In medicine, we call it alkalosis. Remind me, I'll give you how you can differentiate what the strict meanings of basic versus alkaline is. I'm not going to do that now. So in the body, alkaline and basic are often used interchangeably, especially with pH acid-base disorders. So you can, this is neutrality. So as you go above 7, you're moving towards what? Low hydrogens, high pH, alkalosis. When you start to go this way, your hydrogens are going up. There's a lot of acid in the blood or whatever fluid you're measuring. pH is going down because of our math equation. And there it is. So I gave it to you so far, thus far. One way, I gave you the formula. We inverted, we manipulated the pH formula from pH equals a negative log of the hydrogen concentration. We just manipulated it, okay? And here it is, and I showed you what happens if the hydrogens go up. You have a lot of acid, for example, in your blood. Your pH of your blood is going to go down. Your blood is going to be acidic. If you have less hydrogens in the blood, you're losing hydrogens, your pH is going to go up, and your blood, you'll be in a state of alkalosis. Your blood will be alkaline. Okay, and here is the relation. Again, I put it in a different way. So I gave it to you in 3 different formats because I want you to understand this before we begin next week. The big hot topic, which we're going to revisit several times over the next year. Okay, so now let's do the last thing and we'll pack it in. So, for example, let's do this one. I'll do it another way, and since I already gave this to you, this should make sense. We can measure the pH of arterial blood. You can measure the pH of venous blood. You can measure the pH of, once again, joint fluid. You can measure the pH of any body fluid, sweat, bile, pancreatic secretions, gastric secretions. We're doing blood. The normal pH of arterial blood is 7.35 to 7.45, and everybody, I think, there was 29 students that took the test. I think 29 people got that question right. So you have to remember this forever. All right. So where would arterial blood pH be on the vertical pH scale? It would be somewhere around here. Right, 7.35, so it's above neutrality. So arterial blood is slightly alkaline. Slightly alkaline. And that makes sense, right? We're moving up, right? It's above 7, so it's moving above 7. So our blood is, on an evolutionary scale, is slightly alkaline. It's maintained in a slightly alkaline condition. Okay, now, one of the ways we can measure the pH of arterial blood is we can do something called an arterial blood gas. ABG. Arterial blood gas. You won't be doing this unless you're nurses that are, some of you will be in ICU. I like to see some of you in the emergency room and specialty units and critical care, and you'll be trained to do arterial blood gases. Usually though, it'll be the respiratory therapist or the intern or resident or the doctor that will do it. Some hospitals, it is the critical care nurse, because I'm looking to see some of you get certified, nurse practitioners. You'll be doing all this stuff. So you're unlimited in what you can do. And so I encourage everybody to go as far as you can. You can go, it depends on you. So you take this blood from an artery. Not a vein. This is not, you'll be drawing blood from veins all the time. That's called phlebotomy. This is taken from an artery, which is, I'm not going into the mechanics now. We'll get you out of here. I know you're burnt out with this chemistry stuff. So you're taking blood from an artery. And one of the things you can check is the arterial pH. The doctor's going to ask you when he gets the report back, and now you're going to know. And the normal arterial pH is what? 7.35 on a blood gas to 7.45. So on every arterial, when you get the lab results back, either on hard copy or on a computer, the normal pH is going to be 7.35 to 7.45 arterial blood. So you just took the blood, you sent it to the lab, they did the calculations, now they do it with computer. But that's it. Now, the last 2 minutes, when the pH is going this way, okay, say we'll make it 7.2. We'll make it dramatic. So we did a blood gas, and here, I'll put it up here in the green. The patient has a pH of 7.2. Now, if the patient had a pH of 7.4, that's in the brackets. So the patient's arterial blood gas is normal. He's not in acid-base imbalance. But now this patient has a pH of 7.2. Up. Put it over there. 7.2. So you did the blood gas and his pH is coming back at 7.2. So here it is. That's a low pH, right? We know it is. We know when you have a low pH, you have high hydrogens. We know when you have high hydrogens, low pH, you're in a state of what? Acidosis. Okay, so this is going to be very important when we do acid-base imbalances. I will revisit this again and again until I make sure everybody understands it and you're virtual experts. Okay, the last thing, the 60 seconds. What if the patient has a pH of 7.5? You're outside the brackets, right? You did an arterial blood gas, now the pH is high. 7.5. So when you're outside those brackets, remember, bad things are going to start to happen. You're going to start to see signs and symptoms of acidosis. Or when the pH is high, let's go to our formula. This is the fourth way I'm giving it. When you have a high pH, your hydrogens are low in a state of alkalosis. So the first thing you know, look how Anatomy 1, you're already learning pH disturbances. If I do a blood gas and I look at the arterial pH of the result, and the patient has a pH of 7.4, normal. pH is 7.2, right away I know this patient's in a state of what? Acidosis. I don't know what type of acidosis yet. That's what we're going to learn next week. But I know the patient's in acidosis. If the pH is 7.5, I know the patient, right? High pH, patient's in a state of alkalosis. I don't know what kind. I don't know if it's respiratory or metabolic yet. That's what you're going to learn next week. But I know. So already you can determine, as a future RN, whether the patient is in the acidosis or in alkalosis. So I gave you this concept in format in 4 different ways. This is a very good way to remember it. Once again, once you're outside those brackets, bad things start to happen. Okay, so it's 2 o'clock. I will notify you of any changes, but we will continue on, somebody asked before, at, where we start? At 10 o'clock on Wednesdays. Anything else new coming on the horizon, I will text you as far as, or email you rather, about tests and things like that. Once I complete the filming, this is not going to be a live lecture, it's going to be taped. I will then make it available to your site. They sent me a site that then you could look at your leisure. So I'm still doing that. Other than that, any questions on this material?
No.
Okay. All right, so then stay safe. I will keep you updated. I will let you know next week when my corona lecture's out, so you can look at that. You're going to become experts. Okay. I'll see you next week. Okay, take care. Bye-bye. All right, stay safe. Bye.